Health and Human Services Secretary Xavier Becerra says the agency will do everything in its power to give women access to reproductive services following the reversal of Roe. Becerra's action plan includes increasing access to medical abortion and establishing privacy and non-discrimination for reproductive care patients and providers. It also says Medicare and Medicaid will take every legal available step to protect family planning care. For more on this, I am joined by Rachel Rebouché. She's an interim dean and a professor at Temple University Beasley School of Law. Welcome, Rachel. Thanks for being with us. Tell me what obligation you think the move by HHS will place, if any, on those states that have abortion bans in place.
So if you're listening to the HHS, if we're taking seriously their commitment to making medication abortion as widely possible as it could be, that's essentially a preemption argument. That is HHS standing with the DOJ under Attorney General Merrick Garland's leadership and direction, and asserting a claim that with the FDA, that because the FDA regulates drugs, determines their safety and efficacy after decades of research, and then announces a uniform drug policy, states can't contradict that policy by banning a drug that the FDA has approved on the market. And if that were to happen, if that argument was successful, then states could ban other types of abortion, but couldn't ban medication abortion in defiance of FDA policy.
Think that argument's going to be successful?
It's a tough one to make. It's not been tried in this context. Only a couple of courts have found that there is preemptive force for an FDA rule. But if a court agreed, it would be a very powerful argument. It would essentially create a loophole in state bans across the country for medication abortion.
But wouldn't that loophole get recognized by the same justices, presuming the case made its way up to them, which presumably it would? Wouldn't they see that loophole and then essentially rule as they've just done?
Well, it depends on how they interpret a power. The supremacy clause was not an issue in Dobbs, and that is the basis, the constitutional basis for preemption. Loopholes probably characterizing it a little bit of flip, but it would essentially create abortion access within state bans. If circuit courts disagreed, the case would be heard by the Supreme Court, and it's not clear that the Supreme Court would decide on the side of agency power, granting the FDA, recognizing the FDA's power to preempt state law in this way.
Right. Well, I can't wait to continue that conversation with you if it comes before us, given their view about
a tricky one.
The administration's powers. Yes. What else, if anything? Becerra says he's going to operate within, the confines of the law. What else, if anything, can HHS do within the confines of the law to expand abortion rights?
So the HHS can ensure that federal statutes that protect patient privacy, like HIPAA, that federal statutes that require healthcare providers to provide care, including abortion care in a medical emergency and TALA, that those laws are being interpreted correctly and that they're being enforced. It's one of the things that Sarah talked about, and it'd be vitally important in a post-Dobbs country where there's going to be a lot of confusion, particularly in states that ban abortion with very little exceptions and from a very early stage in pregnancy, about what providers' responsibilities are. So as much as the HHS can do to bring information to enforce those federal statutes and protections, all the better.
And Rachel, finally, Becerra also mentioned that there were some ideas being proposed. One of them is possibly providing or establishing abortion clinics on federal land. Could this be a viable option?
If you thought preemption was novel, hold on, because this one is even more so. I believe it's a viable option. It's logistically difficult. It poses risk, but it's essentially using federal jurisdiction on federal enclaves. Those are pieces of land in which the federal government has complete control. There's case law to suggest that the federal statute that would otherwise co-opt or incorporate state criminal law may not apply. if that happens, you would have essentially a federal island within a state where a state criminal abortion ban would not apply. Very novel, never been tested, risk, lots of risk, but is it feasible? It's feasible.
Fascinating. Rachel Rebouché, thank you so much for helping us walk through that. We'll look forward to being back with you because it's not going to get less complicated. Thanks again.
Thanks so much. Thank you.